What are the three most important things I can do as a TOS patient to help myself? Well, the first thing is the same thing we always say here, and a lot of our guests say you have to advocate for yourself. Many patients we speak to come to us having been told that they can't have TOS. Either it doesn't exist or it doesn't look like they have it on a couple of quick tests, like an ADSENS test. But in fact, there's enough to read on Google. Our website, tosmri.com, has lots of educational stuff, and there are other websites that if you as a patient believe you have TOS, it kind of falls on your shoulder to find the right kind of doctor and the right kind of tests. We can help with that if you contact us. We're glad to refer you to people we know who do adequate and better than adequate, excellent TOS evaluation. But don't let a single doctor tell you that can't be TOS because TOS is disputed or you don't have it and they don't even do provocative testing by moving your arms and your neck. So, number one, advocate for yourself. Use all the resources we have on the web and use people like us to help you get pointed in the right direction. Number two, you want to recognize that we still have a lot of unknowns in this field. The previous question about what three things could we do to advance TOS knowledge? Well, that shows you that there's lots of things we still don't know. And that people like me and a lot of other people I work with who are excellent at asking further questions and trying to answer them are very actively involved in this. And I think you should understand that some of these questions you ask might not be answered. It doesn't mean you don't have TOS. It means we don't have a definitive answer for it. And remember, just because something isn't known, it doesn't prove that it's not there. The absence of evidence is not the evidence of absence. So again, don't let a doc talk you out of it because no one has yet confirmed your diagnosis. And the third thing I would say is use the web as we talked about, but use those parts of the web like social media wisely. There are many people out there with opinions. We see it all the time about sports and politics, unfortunately, and about TOS. Because we have unanswered questions, we find people who say, oh, I'll fill in the blanks, and they throw an opinion in there. But remember, as doctors and scientists, we have to have peer-reviewed papers. We have to have papers that other people look at and poke holes at, right, until we're pretty sure that it's a solid theory and it becomes fact in that way. All right. So, what are the three things you can do as a patient? Advocate for yourself. Don't let a single doc talk you out of this. Number two, remember that there's still unknowns in the field, although we have good people who recognize a lot of this. Some questions can't be answered, and don't let anybody else fill in those holes yet. And number three, use social media wisely. Let it point you to experts, but those are not the experts who run social media boards.